Hello, my name is Beth. I'm a student nurse at the University of Detroit Mercy, and I'm going to be doing your head-to-toe assessment today, okay? I'm just going to wash my hands. Okay. Can you state your first and last name for me, please?
Devin McAllister,
Okay, and your date of birth?
3/24/95.
Okay, all matches, good. Do you have any pain or allergies I should be aware of?
No.
Okay. Do you know where you are?
The hospital?
All right, and you know why you're here?
Yes, I'm sick.
Okay, and do you know who the president is?
Obama.
Okay, so the patient is learn-oriented ×4. She's sitting erect. She has good hygiene. She appears her stated age. There's no acute signs of illness. And there's no body odors or anything of that nature. Okay, so I'm going to start with the head. So I'm going to start with palpating her head. There's no lesions, no masses, anything of that nature. There's no parasites. Her hair is full and thick, and so that's good. Okay, so I'm going to start with your eyes. Her eyes are symmetrical bilaterally. Her whole face is symmetrical. There's no signs of drooping. Her pupils are round and symmetrical. So I'm going to check for reaction to light. Okay, and then go ahead and follow my pen light in. Okay, so her pupils are reactive to light bilaterally and accommodation is present. So, can you smile for me? Okay, and puff out your cheeks. Okay, so cranial nerves 5 and 7 are intact. Her skin is warm and dry, so that's good. So can you open your mouth for me? Her oral mucosa is pink and moist. Her tongue, there's no coating. Her teeth and gums are intact. There's no bleeding, lesions, and her teeth are white. Go ahead and say ah for me. Okay. Her tonsils, I would grade them as about a 1. Her uvula is midline and it's mobile when she says ah, so that's good. Okay. So now I'm going to palpate your carotid artery, one at a time. Okay. Okay, so they're equal bilaterally, about a 2+. And then I'm going to check for bruits, listening with my bell. And listen to 3 different spots. No bruits are present. So now I'm going to listen to your heart, okay? But first I'm going to have you grab onto my fingers, okay? Alright, so her hand grasps are equal bilaterally and they're strong. Now I'm going to listen to your heart. Okay, so I'm going to start out with the aortic valve. And it's right of the sternal border, second intercostal space. Okay, your pulmonic valve, it's left of the sternal border, second intercostal space. Okay, and then Erb's point, left of the sternal border, third intercostal space. Okay, and then tricuspid, left of the sternal border, fourth intercostal space. And mitral, which is midclavicular, fifth intercostal space. And this is where I would listen for 60 seconds for the apical pulse. And then I listen to all points again with my bell, mitral, tricuspid, Erb's, pulmonic, aortic. So S1 and S2 sounds are present. There's no adventitious sounds. Then listen to your lungs on both the front, back, 10 spots, and then each side, 2 spots. So go ahead and breathe deep. And I would listen in 10 different spots. Okay, and then I do the back. Okay, and then the sides. Okay, lung sounds are clear in all lobes. There's no jugular vein distension present, so that's good. Alright, so I'm gonna do your extremities. Alright, so I would inspect first. They're warm, pigmentation is even, they're dry, there's no masses, no lesions, no scars, so that's good. So I'm gonna palpate your brachial pulse here. Okay, they're equal bilaterally 2+. Your radial pulse, equal bilaterally 2+. Okay, and so then I'll check your lower extremities. They're inspect first, and the pigmentation is even, they're warm, they're dry, there's no scars. Palpate for any masses. There's no masses. There's no edema present. Okay, and then I'm going to palpate your popliteal pulse. About a 1+ equal bilaterally. Your tibial pulse. 2+ equal bilaterally. Your dorsalis pedis pulse. 1+ equal bilaterally. And then while I'm down here, I'll do the Babinski test. Just going to run this under your foot. Okay. And it's negative. Okay. I'm going to check your capillary refill on your hands, okay? So capillary refill is less than 3 seconds. Her nails are not rigid or anything, so that's good. So go ahead and do this for me. There's no clubbing present. So very nice. So, all right, go ahead and stand for me. Can you walk there and back? All right, her gait is steady. She's no signs of being unbalanced. Go ahead and touch your toes. Okay, her spine has a good curvature. No signs of scoliosis. Go ahead and stand with your arms by your side with your eyes closed for 30 seconds. I'm looking for any dizziness, unbalanced, or anything. Okay, Romberg test is negative, so that's good. All right, so go ahead and lay down, and I'm gonna look at your abdomen now. Okay, so first I'm gonna inspect. Contour is flat. There's no scars. Pigmentation is even. Her umbilicus is midline and inverted. Now I'm gonna listen to all 4 spots or quadrants. And if there wasn't any sounds that I heard, I'd have to listen 5 minutes each quadrant to prove that there's no vowel sounds. Okay. So right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, and vowel sounds are present ×4. Okay, now I'm just going to percuss. Okay, so there's tympani across most of the abdomen and a little bit of dull over the liver over here. All right, so now I'm just going to palpate. Let me know if there's any tenderness, and I'll keep an eye on the patient to see if she cringes or anything, if there's any pain. Okay, any tenderness at all?
No.
Okay, so no mass is felt, so that's good. All right, so in the state the organs, so the right lower quadrant has the right ureter, the right ovary, and the appendix. The right upper has the gallbladder, the liver, and the head of the pancreas. The left upper has the body of the pancreas, the stomach, and the spleen. And the left lower has the sigmoid colon, the left ureter, and the left ovary. And the colon goes ascending, transverse, descending, and sigmoid. My assessment is complete.